Hello, everyone. Sharon D. Perry. I'm on here to talk about anyone who's thinking about getting bariatric weight loss surgery and is doing a vertical sleeve, or even if someone has to have a gastrectomy for other health conditions. One thing we have to realize, because I had to do some research myself, because I got another doctor, a rheumatologist, because I was having so much muscle pain, bone pain, inflammation, foggy memory. The list goes on and on and on and on with all the issues. So I thank God that this rheumatologist is, one, a practitioner, a nurse, and she has experience with bariatric patients, and she's the one that let me know that once most of your stomach is removed, it greatly affects your vitamins. Some vitamins, it needs the stomach in order for it to be synthesized and the body to be reabsorbed from your food that you ate back into the body through the small intestine. So the stomach plays a part, and it releases acid for these vitamins, so it can be in a state that your body can take it up so it can be used in your body. And I did not realize the long list of vitamins that are affected. It's mostly vitamin B12, but there are other vitamins also that's involved. So you have to consider that, because listen, it was to the point where when I walk, my bones hurt in my feet, my blood vessels hurt, my nerves hurt. And I have not been to the gym in, I think, 2 weeks. And I tried walking even through the pain, and I tried exercising. I posted some video, a reel with exercising. Listen, it's bad enough for you to try to tear down muscles to rebuild them stronger, and it's another thing for you to try to tear down muscles and your body doesn't have the nutrients to rebuild them, and you go through a lot that's not fully explained. So you have to consider as much as possible before having the surgery. And I know some people probably wondering if I regret having the surgery. No, I don't. I don't regret having the surgery, because I have struggled since I was 8 years old with obesity. And I had an island mom, and she cooked the same food. Anyone who's from the islands know that the parents, whatever the parent cooked, all the kids ate the food. And my mom had 6 kids, so, and I was the youngest one. You had to eat what was cooked, so all of us ate the food. However, my body was predisposed to gaining weight faster. So if everyone's eating the same food, right, and your body is the one that's gaining weight, it's something else going on in your body. And I have struggled for so long, too long. And no, I do not regret the surgery, but I'm glad I'm learning more about it, because now I can implement even more things to help to become stronger, better, and healthier, and try to reduce, if it's affiliated with the vitamin deficiency, because my body has created masses in the liver. So it was the lungs, the liver, both the lungs. First they thought it was only the left, but it's both. The liver, of course, the left kidney that they said is renal cell carcinoma. It's so many issues, I can't even remember. the list is long, with the heart slowing down, and they're afraid that my heart will stop. So it's a lot of stuff, and it sounds crazy with me saying that I don't regret having the surgery. I don't. I still don't, because being morbidly obese was extremely difficult, even though I wasn't sedentary. For anyone who knows me personally, know I have worked in the medical field since 2006. So we're in 2024, so it's literally almost, in 26 is gonna be 20 years. Right now I'm not working because of all the health issues and everything, but I was not sedentary at all. And a lot of people have this idea that when people are morbidly obese, it's because they have a sedentary life. Listen, I was not sedentary. And even before I became a nurse, my mom was a single mom, so I started working when I was 16. I worked in a factory, I worked in a school, and I went to college full time. I used to sleep an hour and a half to 2 hours a day, I think. I can't remember. Listen, all my life I had to work. So it's not true that morbidly obese people, I was 433 pounds, my highest, and I was not sedentary at all. Okay, and I used to work a lot of overtime in the hospital. Anyone who know about nursing, you spend a lot of time on your feet. My history in medical was mostly med surge, burn, trauma, transplant, cancer, renal. Listen, I did a lot of stuff because it's 18. It's gonna be this year, 2024, going to be 18 years as a registered nurse. I can't believe it didn't been that long. But yeah, so don't believe where people say that morbidly obese people, they'll spend all their time sitting down. I know you hear it a lot, but it's not true for every person. And not only did I work a lot, I used to work a lot of overtime, sometimes 6 days a week. And I used to work when it was still 8-hour shifts, because when I started working, they still had 8-hour shifts. That's how long ago that was, because I know nurses now think that it's always been 12-hour shifts. No. So you will do doubles with your patient, have worked 16 hours and sometimes longer if the nurse that's coming on has an issue and there's a shortage of nurses. Sometimes you can be working there like 20 hours and doing that 6 days a week, 5 days a week. Listen, not everyone morbidly obese had a sedentary lifestyle. It's just not true. I'm pretty sure there are a lot of morbidly obese people that had a sedentary lifestyle. It just happened I was not one of those people, because my life was not in that position that I could be sedentary. I have a family to take care of, and that include my mom, and other things that were going on since I was 16. I didn't have my own kids at that time, but you still have a family because you're born into a family. And yeah, so somebody like, all the stuff you're going through with your body. And the crazy thing is, when the rheumatologist checked my arms, because sometimes they do a test where you have to hold your arms like this, and then they push down on your arms. I'm telling you, the pain in my bones and joints and muscles. And she did it with my legs. Anyone who's worked, oh yeah, I also worked neuro. I worked stroke. I worked brain and spine surgery. Listen, I got a lot of experience, but they do that in neuro a lot. I'm telling you, the level of pain. This lady barely pushed down, and I could not even keep her. And she's looking at me like, Are you okay? Are you in pain? I say, yeah. And she said, oh, let me, because she's a practitioner, a nurse practitioner. So she went to talk to the head doctor because she's like, oh my goodness, we need a lot of labs. She's a bariatric patient, and her body, and they're trying to find out if the tumors are related, and it's a lot. If the heart rate dropping is related, because I didn't have heart issues before bariatric surgery, and I didn't have high blood pressure before bariatric, but now my blood pressure is high after bariatric. So my blood vessels swell big after bariatric surgery. So you have to weigh the cost. And the thing is, even though they have studies, each person's body is an individualistic body. Yes, the studies are important because most people fall into that category. But how do you know if you fall into that category unless they found which tests or enzymes or immune system issues, genetic issues before you had the surgery? And insurance do not like paying for genetic testing because they're expensive. So you have to deal with the insurance issue too. But yeah. So a lot of times you don't know. You're hoping you fall into the category of the typical outcome of bariatric, but if you happen to be that atypical one, you won't know until you have the surgery, unfortunately, and then you find out, oh, so the studies might not apply to me.